Good morning, everyone, and welcome to the fifth virtual GPON conference, Oncology Nursing Now, where do we stand globally? This conference is held as part of the London Global Cancer Week. It's great and fantastic to have you all join us as we come together to share knowledge, exchange ideas, and strengthen our collective efforts in the field of oncology nursing. Reaching our fifth year is a remarkable milestone, and it's a testament to the dedication, passion, and commitment of everyone involved in this growing community. This virtual gathering has become an essential platform for collaboration, allowing us to connect with experts, discuss challenges, and collaborate on advancing oncology nursing. I would like to take a moment to sincerely thank Annie Young and Julia Challoner for their genuine dedication and tremendous effort in making this conference a reality. Your hard work and commitment have been truly invaluable. Additionally, I want to express my gratitude to Karen, our IT specialist, who has been instrumental behind the scenes, ensuring everything runs smoothly. A big thank you as well to all the GPON members who have contributed their time and energy in putting this conference together. Your collective efforts have made this event possible, and I'm deeply appreciative. Before I go any further, I would like to extend my heartfelt gratitude to our sponsors, endorsers, and supporters. Your belief in our vision and commitment to this cause have helped make today's event possible. We truly appreciate your generosity and support. Stay tuned, dear colleagues, with us because at the end of this session, we will be announcing the award, and I'm sure you won't want to miss it. So before we begin, I'd like to go over a few housekeeping items to ensure a smooth and engaging experience for everyone. We have a full agenda planned, so please be mindful of the session time. To minimize background noise, please keep your microphone closed. We encourage active participation. So if you have questions during presentations, please use the Q&A feature. Our moderator will keep an eye on it and raise them during the discussion time. If you have any technical issue, please let us know through friends, colleagues, so that we can assist you. And note that today's session will be recorded and made available for viewing later. Thank you for your attention, and let the fun start, and let's get started with our first session. It gives me great pleasure and honor to introduce today our keynote speaker, Dr. Naeema Al-Gasseer. Dr. Al-Gasseer is a global health and sustainable development expert. She is from Bahrain, and she's a nurse midwife, and she has more than 40 years experience at country, regional, and international levels in the areas of health system, nursing, and midwifery, and humanitarian and development peace nexus. She served for 26 years at WHO in different capacities. She is an advocate for health promotion, climate change, and healthy environment as core for development with gender and equity lens involving public, private, and civil society as one of the key elements of health for all and primary health care. She has served as WHO representative in very hot countries like Iraq, Sudan, Egypt, and Libya, who were under crisis. She has been instrumental in ensuring the full coordination between the UN agencies, NGOs, and development partners, ensuring nurses to be at the decision-making table. And she worked on strategies and plans for informed policy decision-making. Naeema is a graduate of College of Health Sciences from Bahrain. She has a BS from the American University of Beirut, and she received her doctorate degree from the University of Illinois at Chicago. She is the recipient of many prestigious national, regional, and international awards for her achievements. We are truly very honored to have Dr. Al-Gasseer join us today to share insights on oncology nursing in the 21st century achievements, challenges, and future directions. Please join me in welcoming Dr. Al-Gasseer. Naeema, the floor is yours.
Morning
Naeema.
to all. Good morning to all. Thank you very much, Dr. Dumet, for your long introduction. I was expecting a shorter one. I appreciate everyone's appreciation, attention. And also, I would like to acknowledge the delay has been because of my ability to join you. I would like to thank Dr. Mariana Dumet, thank Annie Young, and thank Julia Downing, the steering committee, for this wonderful seminar and webinar. And at the same time, I would like to appreciate today the celebration of oncology nurses around the world, when it is the same year as the 125th anniversary of the International Council of Nurses, where now more than ever the specializations are recognized, and more importantly, the oncology and cancer care nursing. My appreciation goes to all of you, and I would like to really salute each one of you who are working in different parts of the world, whether it is peace or conflict zones. I'm so happy to hear about the global power of oncology nursing. I have to say, I have heard it the last few years, couple of years, from Dr. Mirna. However, I never went to your site and studied. But the whole vision of really looking in terms of importance of sustaining advocacy, leadership, the scientific rigor contribution to strengthen nursing, and more importantly, oncology and cancer care nursing to health of population is really something that we are very proud of, and I'm very pleased to see the success you have made. My session is going to talk about oncology nursing in the 21st century's achievements and challenges and future directions. The focus will be my own journey, how I moved through as from childhood to today, and what did I see, I would say, in over, let's say, half a century of life, of how I handled cancer in my life and how it happened, not myself, but the survivors of many friends. During my terms of the World Health Organization, I was also, for over 26 years, I was also working in the complex countries and led the first global strategic directions for nursing midwifery framework in 2002 that was launched by Her Royal Highness Princess Murad Hussein. Why I'm bringing this? Because those times, the nurses, especially the specialist nurses, including the oncologist nurses, contributed to the status and also the future directions. In that one, we spoke about the needs for the specialization then. I would like also to acknowledge the leadership of Dr. Mirna in our region, that regardless of daily attacks and bombardments in her country, she is still working, mobilizing, motivating the nurses. She in Lebanon, people in Gaza who are still there. Yesterday, we received a video of that with the whole bombardment that's happening, still nurses are working. This is not only in Lebanon and Palestine, Gaza, it's all over. And we know, for example, in Europe, we have Ukraine. However, why I brought this? Because the cancer care nurses, the specialist nurses, healthcare professionals are unjustly attacked. Healthcare services are attacked. Hospitals are attacked without even respecting that there are people, women, children, disabled, refugees are displaced, but at the same time, not respecting international humanitarian law, nor human rights charter. As oncologist nurses, you are already voicing out the lack of access for medicine, for treatment all over. We as nurses and specialist nurses, I'm sure, we are all protected to continue our strive to protect humanity, investing in peace, security, and safety in a world that we are living. We are understanding that what's happening, the dynamics. However, we are enforcing and requesting to enforce the international law and human rights and practice code of ethics to give the care to all vulnerable people, especially people with cancer, because they are most affected and the first affected. I had to handle Gaza situation when we had over 240 children, cancer patients, children, pediatric, were the first hospital that was attacked. And there were a lot of support from different countries in the region to provide, and global, I have to say, including Europe, to support these children. But imagine 240 pediatric children to be displaced for cancer care, taken without, sometimes with their families, in different settings, new settings to them. Where is the care that we want to give? And this is one of the challenges that today I would like to bring to us. We are at the same time celebrating the breadth and depth of oncology and cancer care nursing. I witnessed a lot in my own professional term how we have moved from just nurses basically learning to provide care to cancer patients to today that they are practitioners, able, scientific, competent providers of oncology nursing. The needs are great in all of the regions. But why I want to say, because what happened that I have seen the progress as a person, as a 7-year-old child, myself suffered from loss of my father due to cancer. Just imagine less than 9 months from healthy person going to work every day, suddenly being diagnosed. We didn't know what. As a child, we knew that father is sick, is taken away to be treated, brought back, going to be dying. We didn't know, but nobody spoke about the cancer. They were just saying this bad disease, bad disease. That's such a child what I heard. However, I never forget the caring that was given to him by the nurses. I am not undermining other health professionals, not undermining the doctors. But as a child in Bahrain, during his terminally ill part, we were taken, and I always observed nurses around him giving him a care. That affected me a lot. As a nursing student, my first month assignment in the clinical setting in a hospital, I witnessed gave a bath to a patient, older person, calmly died after 1 hour after the bath. My mentor as a nurse was with me, and I saw how the care not was given only to the patient, but to the family and to the community surrounding, including spiritual. This actually came to my conscious that we need to think of everything. It is not just to give the injection, it is not just to give the medicine, but it's beyond, and that's the nursing care. We as nurses and midwives are committed to actually achieve the commitment of 2030 Agenda of Sustainable Development Goals. Universal health coverage is the core. Universal health coverage is not only treatment. Oncologist nurses are not only working in the clinical settings in hospitals, they are actually contributing to whole sustainable development goals through their various roles that they are playing in the leadership. Whether it's health education awareness, like last month with the pink ribbon and the fighting the breast cancer among the women, but also in their leadership of service provision, setting the protocols, being at decision making that many of you are already there, making the changes, but at the same time looking at how can we bring partners and supporting the families with mental health, working in a team. Today, the sustainable developments have not been achieved much. For example, I mentioned already about the instabilities, but also there is climate change. The resilience of systems. When there is a flood, when there is a drought, when there is a disaster, when there is an earthquake, how can whole community, especially in this regard, nurses and healthcare professionals provide the care? That commitment of really investing in the protection of our planet, people living and livelihood is critical to meet SDG reports. Today, we are behind with sustainable development reports of all this. Talking about oncology nursing, is it a need? Do we need them? Yes, we need. Why? The World Health Organization estimated that the global cancer incidence will rise to over 29 million cases by 2040. That is 50% increase compared to the 2020. And that is the picture that's being depicted. Why do we need the critical role of oncology nursing can play within all our regions and not only with one settings? The oncology nursing indeed is a critical player in healthcare. And I usually talk about oncology nursing, cancer care nurses, because these are some of the titles have been used in different countries, where in my country is called cancer care nurses. In my own country, I have seen the development. Small country, Bahrain, how we were very early on. And we have achieved a lot. Dr. Naeema talked about the decades of achievements. I'm sure each one of you. There has been increasingly recognition for excellence in patient-centered care and oncologist nurses' achievements, providing various services, pain management. Now, people who are my age remember in our generations, we had to really find ways and means to really reduce the suffering of pain of the patients who were survivors. Not only psychological support to them, but also to their family and community on how to handle. Lancet Oncology Report 2023 did say that oncology nurses are key contributors to improving survival rates by ensuring adherence to the treatment protocol. So that means once diagnosed, once treatment is given, the oncologist nurses are critical to provide. We have achievements in technology and innovation. I personally, in Iraq, we really worked in terms of how can we do. I'm talking during difficult times. I'm talking about 2004 to 2006-7. These were very critical times. And how can we make sure that use whatever technology we have, like telemedicine, to really provide services to the most vulnerable, including cancer patients. Basra children cancer patients, pediatric cancer patients, is one of the areas that I worked with. But it was not only to do the technology and innovation of telemedicine, but also to see how to do recording, how to move, which is the cancer registry. If we today to talk about the achievements, the AI tools, Johns Hopkins Medicine have already talked oncology nurses' use of AI, artificial intelligence-driven systems, to monitor cancer patients, leading to a 15% reduction in hospital readmissions. Leadership and advocacy, we are seeing the change, but we have also many examples, like in countries like Yemen, Iraq. These are countries that I've worked in. When the infrastructure is damaged and access to healthcare is limited, the nurses were actually the key caregivers and at the same time advocacy. In Sudan, the nurses were actually coming and calling to see how can we provide within the low resources settings the best services. Lebanon, a country that I studied at and I have gone through different zones of war, because our region, unfortunately, is one of the highest hit wars, sometimes not because of internal, mainly because of the external dynamics that's going on. Nurses, for example, in Iraq, advocated for early diagnosis, radiation therapy, and at the same time, we were critical in actually addressing the radiation therapy. As in my role as WHO representative, we really mobilized the resources to make sure that we do have the radiation therapy, and there were training happening. Opportunities, research fundings. Today, we know that several governments are investing in research funding, several institutions, the global, the Gavi, for example, for vaccines. US National Cancer Institute have, for example, has put $6.56 billion only in 2020 to actually make sure improving treatment outcome for funding and finding cures for various types of cancer. Today, we are seeing a lot of results. Economic investments in oncology and nursing. I'm so happy to see that actually we are investing. The ICN campaign for investment, Nursing Now campaign actually have done a lot of work, and now associations, and including European Oncology Nursing Society, African Palliative Care Association, we are all seeing that there is increasingly figures are given, because that's what people listen to. For example, my statement, economic investment in oncology nursing is a necessity. It is no longer a luxury. So a specialization in this area of care, it is a necessity. We know today that $1 invested in nursing yields up to $4 in return. That's a very critical message. We know that American Cancer Society have already pushed the oncology nurse-led follow-up programs for breast cancer survivors that saved over $1,000 per patient annually in comparison to the physician-led. We need much more of these coming out to make a policy change. Why do we need to invest in oncologist nurses and specialist nurses, cancer care nurses who are wider? Let's go to Africa. African Palliative Care Association highlights that a $50 million investment across several African nations can yield over 200 million in savings by reducing later stage cancer treatment through early diagnosis and nurses-led preventive care programs. Impact investment in low resource settings. I have worked twice in Egypt, first during the 2010 to 2014 when the revolution happened, and then later 2020 to 2023. During these times, I can always say the investment of cancer care has happened. In in Sudan, in Iraq, and in Egypt, one of the successes that we did to ensure it is integrated in the primary healthcare. How? That we make sure that the nurses are part of the early detection team. Nurses are actually giving the alert. However, at the same time, that they are not only in the awareness and detection, but also in the prevention mode, where we know smoking, for example, is one of the main causes of cancer. So nurses are having the role also in the awareness campaign. In these low resource settings, countries that I have worked, including Yemen, I should recall, where we mobilized the midwives, community midwives, to actually do the early detection, to do the early prevention, and at the same time to be supporting the families, to be the advocates for treatment, to ensure that diagnostics are happening. Now, when I'm talking about low resource settings, it's not only countries going through difficulties of wars, but also in terms of financial investments. I want to bring my own story here. As a young professional, advocating for women's health, working with Women's Association and society in the community of Bahrain, I want to bring this message because it brought to me also the ethical dilemma. Why? We were for self-breast examination, invested a whole organizing policies, plans, everything, and started in the community volunteering, advocating for women's self-breast examination. What happened? Imagine yourself as a professional nurse, believer in really early detection, believer that you can save lives, that you will receive calls in the middle of the night, that the people who found a breast lamp in their chest cannot receive a diagnostic appointment very soon. Sometimes those days, it took 4 months to 6 months, like mammography or those days biopsy. What did it do ethically? This conscious ethics of how can we do really be prepared as nurses to really look in terms of how can we balance between creating a demand and having a supply receiver. What do I mean by creating a demand? That we educated self-breast examination. Women found lumps, but they cannot have the supply of doing the full care. How can we handle this? Fortunately, I was among the group that were multidisciplinary group and started to really say, okay, halt, we need to shift our intervention strategy, bring resources to make sure that we have the services and the right people and the right nursing to happening. Why I said this? Because this brought me to my experiences in these countries, such as Egypt, when we, for example, we know that oncology nurses training resulted in improving the survival rates of pediatric cancer patients by 20% between 2020 until now. So these are some of the figures that shows the return on investment. The return on investment, and that is a call for the researchers, for the people who are doing studies. And I want to bring another message. I said investing in nursing oncology is a necessity and it is not a luxury. We need to do the investment in nursing education, research, workforce development, yielding positive outcomes, not only for cancer care, but also for the broader healthcare system. We need to do this. Can be done. We might think it is difficult, we might think it is not right, but it can be done. Evidence have shown that the more we work in clinical care, in actually being advocate for patients, we actually bring resources to bring a better patient outcome. Nurses and oncology nurses are leaders and advocates. They are the policy and influencers. You might tell me, Naeema, how can a student nurse an oncology training can be actually a policy influencer? I tell you, it can be done because we voice health equity, we are voicing the justice, we are committed to our practice of ethics, and we have demonstrated a change. I want to, for example, give you an example. King Hussein Cancer Center in Jordan, which is an institute related to the Mayo Clinic. I had the honor to be working with them, where nurses were actually models for nursing, oncology nursing leaders. And what we did, we brought to them Iraqi nurses and health providers and sociologists to King Hussein Cancer Center to be trained in order to go back. The same I did in Sudan, and that was working with the partners to bring the money. Challenges, we have few challenges here. Workforce shortage is known. We know that WHO reports shortfall of 5.9 million nurses in 2020. 20% of this are actually in the low and middle income countries. We are challenged now that with the shortages in nurses, we are also having disproportionate distribution of oncology nurses. We have countries like Germany, like US, like some of the European, Australia, New Zealand are having much more, Japan are having a much more prepared nurses, but we know there is a great shortage and shortfall is a lot. 5.9 million nurses is a lot, especially in middle income countries. We are having also, like an African Union reported that even we know that the burden of disease like cancer deaths in sub-Saharan Africa risen to 60%, we know that they do not have enough nurses, 0.8 nurses per 1,000 population. Only 1 in 5 African countries have a specialized oncology nurse training programs. This is a message to the theme and to this group of webinar of global power of oncology nurses. How can we invest? This is something that you can look at in terms of really investing, bringing resources, bringing partners to do the nurse training programs. Investment here is very much needed to reduce the gap between the haves and have-nots. We do have the same thing, good examples in Asia and the Pacific region. We know that Japan is much more advanced, for example, but at the same time, for example, Vietnam and Cambodia, they have cancer incidences that are high, and they have issues with the actually having the nurses. Same thing like Africa, very few nurses per 1,000 population. Europe, we have a divide. Now, burnouts is the second issue of challenge that we are having. Burnout and emotional strain. The Lancet Global Health found that nurses working in complex settings are 30% more prone for post-traumatic distress syndrome. Conflict zones and resource setting. I already mentioned about Lebanon and Sudan, but we know that there are other countries. For example, if we just take Asia, in China is not a low resource setting, but they need to have China and India alone account for 50% of global cancer deaths. Now,
Naeema,
what does
Naeema, sorry, one more minute because
okay.
you bypassed the time.
Okay, so for oncology nursing in low resource settings, we need to be creative solutions. We need to scale up through capacity building. We have many examples in Africa, the same, and in Asia and all over. But I want in 1 minute to do 3 things. First, in the future directions, sustainable investment in nursing education and research. It's a much need, and we do need to increase 50%. Advancing equity in cancer care. How can we bridge the gap between the haves and have-nots, especially 66% of cancer deaths worldwide are actually receiving less than 5% of global cancer resources. This is a very strong message. Leadership and advocacy in global context, I already mentioned it. Empowering oncology nurses as leaders while they are students, while they are going forward with mentorship and coaching. Oncology nursing is a critical pillar. I already said it. The tele-oncology is much needed. In conclusion, a call for action for global investment. We know that Global Lancet Commission on Global Cancer says that investing $10 billion annually in oncology nursing training could save over 1 million lives by 2030. Inspiration of future leaders, closing the gap I already mentioned. I have experiences, and the video shows more, of actually bringing the partners, including the pharmaceutical industry together, the call for action. How can we reduce the global burden of cancer through 5 major things? First, early detection, early treatment. Second, prevention, especially healthy lifestyles, reduction of smoking, better lifestyles. Third is actually access to diagnostics and pharmaceuticals. Social corporate responsibility is great, and there are good examples where pharmaceuticals industry have supported in countries. Investment in research and development, and partnership with all. Beside opportunities for funding are great. As a nurses, and midwives, as oncologist nurses, we just need to tap and submit proposals left and right and push for it. Thank you very much. Appreciating your understanding, and I'm here
Thank
with you.
you very much, Dr. Al-Gasseer, for your insightful and very valuable talk. I know you can speak for days and weeks about your experience. Your expertise and perspective have provided us with a deeper understanding of the critical issue that we face as oncology nurses. We truly appreciate the time and effort you've put into sharing your personal experience and knowledge with us today. Thank you very much, and we